Thank you, Mr. Speaker. I would like to yield myself as much time as I may consume.
The gentlewoman is recognized.
I rise today in support of H.R. 1270, the Restoring Access to Medication and Improving Health Savings Act. This bill contains policies that folks on both sides of the aisle can support and have supported in the past. With the cost of health care rising, from hospital stays to doctor visits and prescription drugs, and the ever-present regulatory burdens of the Patient Protection and Affordable Care Act, H.R. 1270 combines three measures that put the people back in control of their own health care spending, gain more access to the over-the-counter medications they need, and decrease government spending. One of the most head-scratching provisions of Obamacare requires people to get a doctor's prescription if they want to buy over-the-counter medicines at a pharmacy with their HSA. This provision is just about the polar opposite most folks think of when buying aspirin or other common medicines at their pharmacy. Instead of simply walking in and paying with their HSA for that medicine, they're turned down and told to set up an appointment with their doctor just to get a script for that medicine. It does not decrease costs for the patient or the government. It actually increases the burden people have to get those medications. Now, they must make the appointment, wait for days or weeks for the visit, and take that doctor's time away from sick patients, all to get some allergy medicine. H.R. 1270 will allow people to use their HSAs to buy over-the-counter medications at pharmacies, because when someone needs allergy medicine during that time, they should be able to get that medicine whenever they need it. With that, H.R. 1270 will allow people to put more into their HSA accounts and match the amount of their deductible and out-of-pocket cost. It will allow people to contribute $6,550 individually and $13,100 for a family, and those amounts will grow with inflation. Another provision that makes it harder to use an HSA declares that taxpayers may use HSA funds only for qualified medical expenses incurred after the establishment of the HSA, which might be sometime after the establishment of the Associated High Deductible Health Plan, or HDHP. The provision that would treat HSAs open within 60 days after gaining coverage under an HDHP is having been opened on the same day as the HDHP. Also, for eligible older married Americans, this bill allows them to contribute catch-up contributions to one shared HSA, simplifying the savings process and ultimately enabling them to save more and gain more control over their own health care. Finally, 1270 will better protect taxpayer dollars and modify existing limits on the amounts to be repaid by those whose advance payments exceed the Obamacare subsidy to which they are entitled. This is a bipartisan offset. Twice, Congress has voted to increase the amount of improper Obamacare subsidy overpayments that need to be repaid. Increasing the recovery of improper subsidy payments was first proposed by Senate Democrats in the 2010 Medicare Doc Fix and Extender legislation. Former HHS Secretary Sebelius described this offset as making it fairer for all taxpayers. As currently structured, the Democrats' health care law fails to adequately protect taxpayers from overpayments of federal subsidies to purchase health insurance, even in the case of fraud. The current law limits the amount of money that can be recouped if recipients receive a greater subsidy than they are entitled to, even if that means keeping thousands of extra dollars in overpayments. H.R. 1270 ensures full repayment for those making more than 300% of the federal poverty level and doubles the current repayment cap for those between 250% and 300% of the federal poverty level. This is not a tax increase or a way to punish those who receive a pay increase. Rather, it is a measure to show our constituents that we are taking care of their tax dollars by requiring the return of overpayments. Mr. Speaker, I will reserve the balance of my time.
The gentlewoman from